Well, Elevate Truth TV again, back to speak about whether we need one shot or two shots. Well, I don't want to deceive anybody because the fact of the matter is this: I don't believe we need any shots. But we need to go into the mind of the people who are taking these shots, taking the vaccine, have been seduced to believe that they need a vaccine. And I want to really analyse what they've been telling us to see how dumb they think we are, how stupid they think we are, and also to look at the way they program us. And the last thing is the fact that they've gone into panic mode. Now, when they were talking about this original vaccine that was going to come on the market, it was designed to be in a two-shot thing. You know, two doses of this vaccine at a specific time and a specific length of duration when you need to boost, because boost is going to be a word we hear a lot. Boosting the immune system. Don't forget also that vaccines, we've been indoctrinated to believe that as soon as we come out of the womb, as soon as we're born into this environment, we need to be vaccinated because it's a hostile environment. So we didn't come with any shield to protect us from this hostile environment. That's one of the programmings that we've been given. And I believe that programming that we've been given has enabled a lot of people to be deceived into this whole new agenda. So like I said, they told us one thing and now they've switched up the agenda. And because they've switched up the agenda, they're out to go into damage control. So I want to take you back to some of the things that were said. First of all, we had this. Let's go in.
Our yearly effort to avoid the flu involves one shot in the arm. The much anticipated COVID-19 vaccine will involve two shots. Why? Here's our Why Guy, all new this morning.
When your lawnmower has been sitting in the garage all winter, the engine needs a little encouragement before it starts working again. Sometimes your body's immune system is the same way. You've probably noticed that the most advanced candidates for a COVID-19 vaccine will require 2 doses. It's not uncommon. Many vaccines require more than 1 dose. Let's explore why. Different vaccines teach your body how to recognize and combat different diseases. One lesson may be enough, but not always.
There may be some proportion of people who are protected, but you may not have an optimal proportion of people who are protected.
Like hitting the primer on a cold lawnmower, sometimes your immune system needs a little added boost to fight some diseases. The first dose of a vaccine does the priming, then comes another dose.
The second dose is more to ensure that everyone gets that full response, and so you can see a lot of variability from vaccine to vaccine.
Your body produces more antibodies with that second shot, along with an ample supply of memory cells that remind your body how to fight a particular illness years later.
You have immune cells that then get stimulated and make more immune cells that are more ready to deal with the invader.
Sometimes multiple doses are taken several weeks apart. Sometimes it's years apart. Those memory cells don't last forever. After the initial round of tetanus shots, it's recommended you get another booster round every 10 years.
So this explains the notion that the body needs to be told what to do with one shot. It needs to be switched on, so to speak, because it's not working very well. It's tired, like an old lawnmower that's been kept out. It doesn't work that well, so we need one shot and then we need another shot. But let's go a little bit deeper because, you know, I want to show you that the original idea was that this was a necessary process, a 2-stage process, necessary. It was designed this way and it had to be done this way. Let's go in again.
Concerns surrounding a COVID-19 vaccine, and Joe Chiodo has tonight's Good Question report.
One of our viewers asked, why do the coronavirus vaccines require 2 doses? And what kind of challenge does that present when it comes to getting people the shots? Here's what you need to know. The first shot, it primes the immune system since it's never seen such a virus before. Your system will process, recognize, and then remember the virus. Within about 14 days, experts expect it to develop antibodies. Now on to the second shot. It strengthens the immune response so you'll be able to better fight COVID if you contract it down the road. Researchers Doctors noticed after the second dose, participants produced even more antibodies. The two would be spaced out about a month apart. You may also need a booster shot several years down the road, but we'll have to wait and see exactly how that works. Now, there are two major issues with two-dose vaccines. First, double the vaccination, well, that means double the work, so costs will increase. We will now need twice as many vials, syringes, freezer space to store the virus, and more hospital and clinic staffing to get the job done. Now, the second issue, that's getting people to return for their second critical dose. Experts say it is well known that with two-dose vaccines, a measurable portion of the population actually don't end up following through and coming back. Here's one example for this. Research from the National Library of Medicine has found less than a third. That's right, a third of young women who got the first HPV shot for cervical cancer end up returning for the remaining two doses. It will be very important for doctors' offices and hospitals to keep track of people's vaccination records in order to send them timely reminders to show up for that second shot. They plan to do that via index card in the mail. Doctors also worry the first shot could make some people feel sick, and then that would deter them from returning as well. While it is common to have a two-dose vaccine, the circumstances surrounding COVID actually are not common. According to the Immunization Action Coalition, this is the only time in history that the world has faced a serious immediate pandemic threat to the population that requires a two-dose vaccine.
So I want you to take note of what this man just said. In one breath, the man said that they have data showing that when a stage 1 vaccine is given, a lot of people will not return to get the second dose. They have data that shows that. But then at the end of the segment, the man said this is the first time in history that they've needed to use a two-stage vaccine. This was unprecedented, basically, is what he was saying. So that's doublespeak as far as I'm concerned. It doesn't make any sense. So the thing is, what I want you to focus on as well is if they have the data showing that people will take one stage of the vaccine and not turn up for the second. If the governments have this data, then don't you think the decision to only give one vaccine is potentially putting people in danger? Delaying it even, when the vaccine was designed for the second dose to be given at around 20 to a month later. Doesn't sound correct, does it? Or does it? Because to some people who are not thinking critically and are not using their own mind, I guess it does sound okay. So I'm going to go to another expert who pushes home the reason why they say they needed 2 doses of the miracle vaccine. And I'd like to bear in mind as well, nobody seems to be talking about the fact that you could be vaccinating people that have the virus, because as we know, this is a virus that you need a test to know whether you've got it. In most cases, you can be just fine. Everything can be nice and fine, and you're walking around infecting people and you don't know you've got the virus. This is what they tell us. You can have no symptoms at all and still have this deadly virus. So the truth is that you might be vaccinating people who already have the virus. So what does the virus do for those people? Does it remove the virus from their bodies? Does it kill the virus? Don't know. These are questions we need to know, because a lot of things that they don't seem to know, but are willing to take a chance with us, with our lives, or at least the people who are willing to take it. And I don't want to call those people stupid, because a lot of people are operating from fear, are they not? Because we're being manipulated through fear. But let's go to this so-called expert. And he states, when he's speaking, that there is a lot of experts that are in line with what he's telling us. Let's take a listen.
For the latest on the coronavirus vaccines, I want to bring in CBS News Money Watch senior reporter Stephen Gandel. Stephen, welcome. Great to see you. So both the Pfizer and Moderna vaccine require 2 shots taken weeks apart, which complicates matters somewhat. You've been reporting on how significant it is for Americans to receive both doses of the vaccine. Tell us how you found vaccine efforts could be undermined if people only get 1 shot.
Yes, I don't think people understand how big the stakes are or how dire the consequences are if people only get one shot. I thought, and I think what the government seems to think, and others, not in the health profession, think, well, if people end up getting one dose and they don't get two doses, then they're just not going to be immune to the coronavirus vaccine. Well, it's much worse than that. If a lot of people, and I talked to some experts on this, they've been looking into it a while, experts on evolutions of viruses. And the concern is that if people get one shot and not two shots, and then those people get exposed to the coronavirus, the virus won't get killed off of them. It'll live, and it'll figure out a way to adapt itself and get around the immunization efforts, the vaccine, and then it could spread again. So the possibility of this, and so then we could have a vaccine-resistant strain of the coronavirus out there, and we'd have to start this whole vaccine process over again. We need some other new vaccine to get around the problem that just got created. Now, the chance of this, what I've heard, I know it's when I found out about it, I was not happy. So the chances of this are low, but if we don't do a good job of getting people back for that second vaccine, it could be millions, tens of millions of people. And the more people don't come back for that second shot, the higher possibility of this nightmare scenario.
And what you must remember here is that this individual was part of the indoctrination process to make sure that people were in so much fear that they definitely came back for the second shot. He was pushing home the ideology that not only will it not be have any immunity if you just take one shot, that the coronavirus itself could mutate and find a way to counteract this single shot that hasn't given you sufficient immunity. This is very, very interesting what the person is saying here, because he's basically saying that everybody now is lying to us, unless he was the one who was lying to us. Now we know in the UK here that they've decided that we no longer need this important second shot, and that if it's to happen, it can come down the line. But in order to make us buy this new thing, this new eventuality, they had to rewrite history in a sense and reprogram those who were willing to let themselves be programmed. And that process started like this.
Davies left home today thinking he'd be getting the first of 2 doses of the Pfizer vaccine. He was devastated when he got to the clinic and was told his second jab, set for 21 days' time, had been postponed.
I was quietened. My heart had been bumping with enthusiasm and delight, and it slowed down. And I came out pensive, and I wasn't smiling behind my mask when I spoke to my wife. She knew straight away that something was wrong, and I said, I'm very worried about what is happening. I'm not sure that this regime is the one that the regulatory authority sanctioned when they gave the go-ahead for this vaccine.
Yesterday, the government changed its guidelines on the Pfizer vaccine. The advice had been to give 2 doses within 3 weeks of each other for best protection. Now they say within 3 months. And GPs told us the change is at best confusing, at worst off-putting.
When you're going through the consent and explaining the treatment and the importance of getting that second vaccine and the importance of having it 3 to 4 weeks afterwards, and now suddenly the news comes out that that's changed and don't worry, it is fine just to have it 12 weeks later, I think that's going to cause a lot of worry and confusion amongst patients.
So wait a minute, it's at best confusing and at worst off-putting. I thought at worst it should be dangerous to have designed a product that you say to the public is almost 100% effective with 2 shots. But now you're willing to just give 1 shot, and somewhere down the line you might get the second shot. Shouldn't it be worrying in it on a different level, especially if what we've been told before is true, that you need these 2 shots? and that in order to give you the best chance of having any immunity is to have the 2 shots. Is that all it is? Just slightly worrying. And this individual that they've wheeled out here, who's talking about his heart was racing with excitement to get the vaccine, to get the 2nd dose, and now he's despondent, and his wife even know that he didn't have the smile behind his mask. Why would he be wearing a mask in his house with just his wife? I don't know, but she could tell that something was wrong. This is them trying to speak to the concerns of people, trying to vocalize what some people who have fallen for the whole trickology are feeling, trying to put in place some kind of reassurance. Not enough though. So that's why we had to come with experts like this who start to contradict the whole narrative that we've been told about needing to. Listen to this one. Look at his eyes as well. You wouldn't trust this one as far as you could throw him.
Venture technology at Stansberry Research. Dave, welcome. What do we know?
Pfizer released some confidential data through the FDA. Now we can look at that data. It's no longer confidential. We can see that 10 days after the first dose, people who got Pfizer's vaccine almost never convert to COVID-19.
What does this really mean in terms of how many people can get the vaccine, Dave?
It really looks like 1 dose is going to do it for everyone in the vaccine trial who got the vaccine. So we have hard orders for 100 million doses of Pfizer's vaccine that comes in 2 groupings. The first grouping is essentially immediate. We'll get 50 million doses right away. And then 9 months from now, we'll get another 50 million doses. If we have to dose everyone twice, that 100 million doses covers 50 million people. If we can get away with 1 dose, that covers 100 million people. Meanwhile, there's a dose from Moderna, a vaccine from Moderna. We'll see data in about a week. And that essentially is going to produce identical data to Pfizer because it's an identical RNA with a slightly different wrapper. And in phase 1 trials, it had the same efficacy and the same side effect burden. So we suspect that we'll see almost identical data. In fact, we already know that the efficacy data is within like 0.1%. One's 93.7% effective, the other's 95% effective, but statistically, those are the same number.
I think what I'm hearing is that 200 million Americans could be vaccinated between the Pfizer vaccine and the Moderna vaccine by the end of next year if they each get a single dose, right?
Exactly correct. Moderna thinks that they'll have 125 million doses available, okay? When you add that to Pfizer's 100 million doses, that's 2.
Wow. Lo and behold, now we're being told that it just works with 1 shot. The evidence is there. Or is the evidence there? We're guessing at the evidence, but when it comes out, we know that the evidence will show that you only need 1 shot. And people that have had the 1 shot don't get it. Don't get COVID. That's what it's appearing to be. So we need to get as many people vaccinated as possible. We need to get as many people taking the 1 shot as possible. And that's what really is coming out now. That's what is really showing, that it's not about the safety of people. It's about just getting as many people getting that 1 shot as possible. We heard earlier that a 2-shot vaccine is a very expensive thing and causes problems in getting people to return. If they just concentrate on 1 shot though, they don't have that problem, do they? And they don't have to think about getting a vaccine that is just a 1-shot vaccine. They can just convince the masses that what we said earlier, we didn't say. And anything that we may have said about the safety of just taking 1 shot is now raised. You're not supposed to remember that, because that's not the narrative we're pushing now. So I'll go to one of the main programming programs, the main mental influencing programs that we have in the UK here. And these 2 characters that you should know very well, I've highlighted them before. Let's go in and have a look at what they're saying.
Legal action over this delay. Why is that? I'm interested in the fact that the vaccination that is delayed should be backed up by data, and it isn't at the moment. I'm interested in of course, getting as many people vaccinated as possible. How could one not want that to be so? However, I don't want the fact that there's a delay in the Pfizer vaccine to 12 weeks to in any way invalidate that vaccination. I mean, I've got a letter here from someone who is supporting my move, and he's an older person, just wrote into me. I do not want to be walking around with false assurance that I am immune to COVID, thereby putting myself and others at risk and adding to the already heavy burden on the health service.
Well, what we know, Dame Joan, is this. We believe we know this, that once you have the first Pfizer vaccine, in the first few days you have a 52% or so efficacy, protection, immunity, whatever you want to call it. But that after 3 weeks, that actually moves up to 89%, which is 20% more than most of the flu jabs on a seasonal basis. So it gives you incredible protection after 3 weeks, just the one jab.
I'd like to, I'm pleased if you can give me the data that says that, but Pfizer themselves don't say that. They haven't tested it at that extension. And the World Health Authority also says that hasn't been demonstrated in the data.
No, hang on, sorry. I think
bring in Professor Sridhar here, because...
Yeah, we need to establish, Professor Sridhar...
Whoa, wait. It needs to be backed up by data. Did you see how they stopped her there? They didn't want people to be thinking about something being backed up by data. But I'd just like to make you sure you understand what's going on here. The first person they speak to here in this little crew of people is called Joan Bakewell, Dame Joan Bakewell, and she's supposedly bringing a legal action against the companies for deciding, against the government or against the companies, which is very interesting because the companies can't be sued for anything. But she's stating that she's bringing a legal action. She's happy that the vaccines have gone and her agenda is to get as many people vaccinated as possible, but she doesn't like the fact that it's no longer 2 stages. And our people, she reads something from somebody that says, our people, as an older person, am I walking around with no immunity? Because that's what they're trying to convince people of, that it's still effective. But when she raises the point that there's no data to back up that it's still effective and can go to almost 83, 85% effectiveness after just 1 dose, when she says there's no data, whoa, let's stop there. Let's go to the doctor. They don't want her to go off script and start talking about the fact that there's no data to back up the effectiveness of just 1 dose, because there is no data. It was never designed to be that. So let's go to this doctor and hear what this honest person, and I'm being facetious when I say honest because we know that they're liars. And I want you to actually look at the fact that this person is trying to prevent herself from laughing. Dupe and delight. She knows that her job is to put over on the public the idea that the data is there. So what does this lying person say? Let's take a look.
Established, Professor Sridhar, after 3 weeks you do have 89% protection. I think that is clear in the data. The issue is over the 3-month delay and what protection you would get with that extension.
Yeah, exactly. So the JCVI, which is the body in the UK which made this decision, and it's made up of scientists, as well as the British Society of Immunology, have come out and said that given that more people can be protected and protected from hospitalization and death, and given the high efficacy of the first dose, that this would be the correct way forward. But I understand Dame Bakewell's concerns because we are one of the few countries to be doing this. The United States is not taking this path.
Is the data there, Devi, that says after 3 weeks after the first Pfizer vaccine jab, you are 89% protected?
So it's kind of in a typical academic way. It's there and it's not there. So the JCVI have modeled this.
Now, if you've noticed, this person, this doctor, has had to be asked twice if the data is there, and I made a mistake before, it's actually 89% their effectiveness, they're saying. 89% protected you are, whatever that's supposed to mean. Because You're either protected from something or you're not. But I guess they have to protect themselves so that when people start falling ill from stuff, they can say, well, you know, you're just one of the people that wasn't covered, you know. You're 89% and you didn't fall within that category, so, you know, we've protected ourselves in that sense. But this lying person and these deceptive reporters, Pierce and the other one, are pushing the agenda, and it's taken twice this person to be asked, this so-called honest person to be asked whether the data is there or not. So after being asked twice, after being forced twice to sell the public a lie, what does she say? The data is there and it's not there. What is that supposed to mean? The data is there and it's not there. Well, let's listen to her a bit closer to see exactly what she means, whether something can be there and not there.
Happen and kind of estimating it. So it's an estimation based on a scientific assumption about immunity, but it's not there. I don't think Pfizer itself has released that data.
Okay, let's bring...
So after lying to us and telling us that the data is there and it's not there, she comes clean and she states that the data's not there, that Pfizer haven't released that data. But there's been an assumption made that it will be effective. So she's basically saying that it only takes an assumption by authorities, by experts, to assume something's there, and then this is enough for the public to swallow it. Let's go on to see how this debate, so-called debate, pans out. Remember, there's nothing about debate here. It's a scripted scenario in order to push an agenda. But let's see how it plays out. Let's listen to further people in this scenario.
Well, I certainly am, because due to my great age, two things are true. One is that I am more vulnerable to serious illness if I catch it. The other is that I am not a frontline worker. And by frontline worker, I don't just mean doctors and nurses, wonderful as they are. I mean Roy, my postman, who gives me a cheery wave every morning. I mean the guys who deliver my groceries once a week to me. I mean the dustmen and women. I mean all those people in that extraordinary life-saving chain, which means that they have to meet other people. I don't have to meet other people. I am self-shielding. I am of an age when I can do that. They have to meet other people, the people who stack shelves in supermarkets. I want them to have my second jab. It's terribly important to me that they keep going. And for their own health, we know this new mutation is starting to hit younger people than the first kind of virus. I want them to have this 89% protection. All right, I'll have my second jab in 12 weeks. And as I understand it, it will increase the longevity of my immunity. Thank you. I don't regard it as a right. I regard it as a privilege.
I think one of the problems, and the reason I have sympathy with Jeff Boycott and with Dame Joan, is I think one of the problems is people were told you've got to have your second Pfizer jab in 3 weeks. It's very important. And then suddenly it's deemed not so very important. And as Debbie says, the science is sort of there or it's not.
Here we have Esther Ranson, childline exponent and friend of the notorious Jimmy Savile. What she's doing here is putting herself across as the martyr. And also she wants to speak, she's been brought on to speak to the elderly people who have been targeted by the system to get this vaccine as soon as possible. So she's been brought on as an example to quiet their fears, because amongst the population, I will say that the elderly are the most fearful. So they've brought on this person that they can relate to become the martyr, to say, oh, I'm not high risk, all I need is just one shot, and then down the line I'll get my second dose. And I believe when I get that second dose I'm going to be even more protected. It's going to boost my immunity in the long term. Is the data for that? Well, she's trying to put again across the idea that there is. And then we go back to Piers, who's talking about the fact that the doctor hitting home the idea that the data is there and the data is not there. As if you can have a concept like that. Even though when the doctor was pressed, she said that there was no data. Hasn't been released by Pfizer. And it should be worrying to anyone that it's actually Pfizer who's putting out the data to start with. Shouldn't it be worrying? It would worry me. But it's not about me, is it? It's about the masses that are taking in this nonsense, being seduced by this stuff. But in order to make the seduction proper and effective, what they almost must do is go back to the fake doctor, the one who is esteemed and has authority over people, the doctor. Let's go to hear what he's got to say. Because don't forget, we opened this segment with somebody that was bringing a legal challenge, supposedly bringing a legal challenge. Now we end with the doctor saying this. Let's have a listen.
If there was going to be a legal challenge down the line, it would surely be for people who've got no protection whatsoever. When we have vaccine available and we're thinking of giving it to people who've already got a good level of protection from the first dose. For me, that would be the legal challenge. I'm with Esther, I'm with Debbie on this, that you can't look at a certain small set of data in a limited amount of trials where you've got massive experience saying that you've got good immunity after the first dose, give a delay to the second dose that more people...
Hear what he says? I'm with Debbie, the doctor, I'm with Esther. If there's going to be a legal challenge, so this is wiping out what the dame is supposed to be doing, the fake legal thing that she's supposed to be bringing, you'll never hear anything about this legal thing that she's bringing, I can assure you of that. But here's what it is. The doctor now, the one they end on, the authority, is stating, if any legal challenge comes, you know, it shouldn't be about, you know, this dosage when we're actually giving somebody a number one dose, which gives quite a good level of immunity. That's what he's saying now. So this is where we end the propaganda, the programming. We end it on a note where they've said, where they believe they've quelled the fears, they've gone round the houses and they've made you, the people who are going to be taking this vaccine, able to overcome your fears of taking something that is now being given to you in a way that was never supposed to be administered in this way. They're trying to convince you of its effectiveness. Now it may seem that I am trying to spread doubt in those people that are willing to take this vaccine. Well, it's for you. If you want to decide that you want to put something into your body, you know, your body, your choice it should be, shouldn't it? You know, I want to keep people as safe as they want to be, and I would like to think that, you know, I'm not influencing people negatively, but I'm just trying to show you the lies that are being told. And if you don't believe that lies are being told, I'm going to go to one other TV doctor, the smiling TV doctor, the smiling devil I'm going to call her, because many people know this person. But what's happened as a result of what this person has said has caused a lot of complaints. Why? Because when she was being paid to say certain things, she went slightly too far and went off script. But I can assure you that when the presenters reacted, it wasn't because they were trying to stop her giving bad information. It was because they want people to take this without coming out into the open too much and forcing it down their throats, or into their arms, should I say. They want you to believe that you've made the decision. So they don't want to come out too blatantly and lie. But this one did just that. So let's have a listen.
Well, what's really excellent is, and it's a statistic that I think should be shouted from the rooftops, is that after 12 days from the first vaccination of the AstraZeneca vaccine, you are 100% effective against hospitalization and death. So, you know, those are the statistics we need to be hearing.
Why haven't we heard that before?
Well, here I am. I mean, that is an excellent statistic, and I think it's one that does need to be shouted about. Absolutely. But it's one that's only just been released. You know, we only have some of the data available to us. But certainly, even the 70% effectiveness is a very good statistic. It makes it highly effective.
So there we have it. A doctor who has taken an oath to protect lives, is stating that after 12 days of taking the AstraZeneca vaccine, it's 100% effective from being in hospital and even death. And even the presenters knew that she'd gone a little bit too far in their desperate bid to have people vaccinated for something they do not have. It's a disgusting situation that we're in. And this final clip that I've shown actually shows the venom that is beneath the lies that are being told to us. Because only venom, only hatred of humanity would have a doctor who, as I say, is supposed to have taken an oath to protect lives, would have somebody going so far as to make these claims 12 days after taking a vaccine. You are immune. It's so effective. Well, that would be some kind of miracle, wouldn't it not? But if we go back to everything that's been said in this episode of Alibi Truth TV, I think everything, if it was true what it was saying, would be a miracle. The truth is this: in life, nothing is guaranteed. And they can't guarantee anything to do with this vaccine. And they're not. But they're wanting us to believe certain things about an untested, largely untested drug that they want us to put in our bodies. And they want it to be happening very, very fast. I want to liken it to this. You meet someone, you meet a female, and for the females, you meet a guy or whatever. And within 10 minutes of meeting them, they want to be moving into your place. You know, his and hers towels and all that kind of thing. You should be thinking, this ain't right. It's not good. It isn't going to be good down the line because they're moving too fast. Well, I think they're moving a little bit too fast with this, wanting everybody to be vaccinated as soon as possible. You know, because obviously they're telling us that so many people are dying and, you know, we need to be locked down, and the only way out of a lockdown is to be vaccinated. We need as many people to get that one shot as possible. But remember, what's been shown in this is that it's been lie after lie after lie. I just want to expose the lies, that's all. Why? Because it's Alibi Truth TV. I'll see you very soon.